Nebraska lawmakers repeatedly strike down medical marijuana bills. Tonight, a neurological scientist at the University of Nebraska Medical Center shared research supporting claims that medical marijuana helps with pain and seizure disorders. But as Kent Lutzen learned, he isn't saying the drug is the right choice for everyone.
As more states jump into the U.S. marijuana industry, the multi-billion-dollar business is sure to keep growing. Although a proven moneymaker, concerns surrounding the drug's health impacts are still being researched.
We're in the midst of a really profound cultural shift, and I think that's why there's so much interest.
Dr. Matthew Garlinghouse, a neurological sciences professor at the University of Nebraska Medicine Center, shared his thoughts on nearly all things marijuana to a group at the Omaha Science Cafe on Tuesday. Through his research, he says marijuana is beneficial for patients who struggle with severe pain and seizure disorders. On the flip side, he says the drug can cause increased anxiety, psychosis, and permanent changes to the brain of younger users.
It may normalize brain function in some ways, but at the same time, for non-affected groups like normal folks, when you go online, it cures everything. And unfortunately, that's not the case.
Those in the crowd were mainly from an older generation, many just trying to learn more about the pros and cons of the drug. Gary Hoffman was one. The nurse has holdups, but has seen the benefits for some people.
I've had to deal with a lot of seizure clients working for the state of Iowa. And, I had to do emergency care to clients, and the cannabis is certainly an intervention that is meaningful. And people purport that, it works and it's effective.
Sherry Lawler wants medical marijuana legalized in the state of Nebraska and is working on a petition to get it on the ballot in 2020. Her daughter has epilepsy.
I just want her to have another medicine available to try and see if it will help her with her seizures.
As the legalization debate in the state of Nebraska continues, Garlinghouse says more research on the health impacts wouldn't hurt.
The society is now outpacing the science, and so it's the ultimate, I think, answer is still yet to be determined.
In Omaha, Kent Lutzen, 3 News Now.
Garlinghouse added he doesn't feel like states really researched the implications of legalizing recreational marijuana before unleashing it on the public.